afternoon. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute here in Florida. I have with me one of my patients who underwent a very unique and special procedure that we've developed here at the Deuk Spine Institute. It is called the Deuk plasma rhizotomy. It is used to treat pain from facet joints. Many people suffer with neck pain, back pain, or even thoracic pain that comes from small joints located in the back of the spine. These joints are called facet joints, and there's a left facet joint and a right facet joint for every disc that there is in the spine. This patient had facet joint pain in his thoracic spine, and 5 weeks ago he underwent a Deuk plasma rhizotomy to deaden the pain nerves to those arthritic joints. He's here today with me to share a little bit about his story. How are you feeling today?
I feel great.
Good.
I absolutely feel great. I'm no stranger to Millennium Medical and Dr. Deuk's team. For years, I've worked with Dr. Patel and his team with pain management. Every time I came in to see Millennium Medical, I had issues with my lumbar. So for the first time, I began having thoracic pain higher up, and it was inside my right shoulder blade. I thought maybe I had sprained myself, and it went on for several weeks and about a month. I said, this is getting to be fairly painful. I thought I'd better come in and take a look at it. So I worked with Dr. Patel and we did a procedure, and the procedure wasn't enough to resolve the issue. He recommended that I come and see Dr. Deuk. So we had a consult. Following the consult, he realized what we needed to do, offered the opportunity for this procedure, and we did so in late August. The experience with Dr. Deuk and his team was just simply outstanding. I'll say that from the very beginning, I knew exactly what to expect, what the procedure was, how long it would take, the different steps, and who I would meet, and so forth and so on. I remember vividly the morning of my procedure. I was in the area there preparing for the procedure, and everyone came in and introduced themselves and told me exactly what to expect, and so forth and so on. It was very, very comforting. And I was so impressed with everyone. Following the procedure, and the procedure itself, I understand I was obviously out of it, but the procedure, it was like a 25-minute procedure. The entire time here with Millennium Medical was about an hour and a half total. Following the procedure, I went home relaxed for the rest of the day. The next day, it was normal ops. It was fine. The pain was gone immediately following the procedure, and I began physical therapy very shortly thereafter, within a few days. I had some, as I was told, I had some occasional discomfort, but it was nothing at all like the pain that I had had prior to the procedure. In fact, the head nurse had said, you're probably going to feel something that feels like a little sunburn, but in your back, kind of deep in your back. That's exactly what it was. It was absolutely nothing compared to the pain I was going through. And it didn't last long at all. And after about 3 weeks, that very occasional sunburn pain, I'll call it, was completely gone. I was completely healed by about the 3 to 4 week time frame. I cannot say enough for the Deuk team, the professionalism, and I'm just delighted to be where I am now with the procedure.
Well, we're delighted that you've gotten the relief that we've hoped you got. You know, treating facet joint pain can be difficult. There's a lot of arthritic changes that occur on those joints. The type of changes that occur at these joints are enlargement of the capsule and thickening of the capsule. So that makes it harder to actually reach the little pain nerve that goes to the joint. When you start getting the bone growing and the overgrowth of the capsule, it basically shields and protects the pain nerve to the joint. But it makes the RFA procedure not work.
Not productive, huh?
Right. So we brought in a very powerful tool, and it's a plasma generating probe. And I just used that probe right through here, and I made sure we annihilated the pain nerve.
Well, I am too. It's delightful, and it was the pain. The procedure itself was absolutely painless, and again, I'll say, following the procedure, I went home for the afternoon, felt nothing at all. The next day was back to normal ops, and smartly getting back into life following that. But going through physical therapy, and it's been a real pleasure. Very pleased.
Thank you so much, and I'm really happy that you're willing to share your experience here once again with the Deuk plasma rhizotomy for your thoracic spine. Anything else you want to tell your fans out there?
if I had to do it again, I'd do it again in a heartbeat. No question
you.
about it. And I certainly trust Dr. Deuk and the Millennium Medical team with all of my issues.
Can we just talk for a moment about your experience in the military? What exactly was your role in the U.S. military, and what are you doing these days?
Sure. I spent about 25 years in the military. I began before I went to college, and I was a maintenance crew chief on the fighter aircraft. Spent my time in Vietnam. Following that, went to college and came back, and I flew for the Air Force for about a dozen years. And I flew bombers and fighters and reconnaissance. And as my wife says, I like to say, I'm a 6'4", 6'5" man in a 5 foot, maybe 8 or 9 cockpit. So that may be why you and I are sitting here today.
Yes, I understand.
But I'm very fortunate. My wife and I had a great opportunity. We were living in a motor coach full time, like you had yourself, full time living in a motor coach for about 16 years. And as we were preparing to retire in life and choose that next chapter, we really didn't know what we wanted to do, where we wanted to go. Quite frankly, because yourself and some of our other medical professionals were here, we knew darn good and well that it would be a wise move to live in Central Florida. We love the Melbourne area, and it's a good thing because routinely I'm in to see Dr. Patel and Dr. Deuk, and it's all good. It's all good.
Well, thank you, and we're hoping you no longer come to see us for medical reasons, but we can work on collaborating together to bring our treatments to more people.
I'd love that. I'd love to.
Thank you so
My
much for
pleasure.
your time.
My
Appreciate
pleasure.
it.